Okay, hey Chad, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment where this meniscus tear is, and it's pretty easy to see right at the beginning of the case here. This is a shaver on the right, that little tube. You can see how it spins pretty fast. It has suction attached to it, and so we're using it right now primarily just to irrigate the knee, but the meniscus tear is all through here. You can see all of this tissue doesn't look like it's in great shape, so we're going to get to work on identifying exactly what we can do to make this better for you. We're going to start with the probe. Obviously the edge of it is torn and split. So this is, remember we talked about the different zones of the meniscus. This is a tear that this part we're not going to be able to fix because it's right on the edge. It won't even hold a stitch. We'll take a little basket forceps and trim that a little bit so we can actually see the part that we can fix. Awesome. Okay, that'll work. And so this is basically just a little pair of scissors. And we're just going to trim the edge. We'll turn on the outflow just a little bit on the scope. Right here. Right, no, right here. And then we'll get back to work here. Okay, so we're going to stop there and now reassess. We'll place our shaver back in. Okay, and now we've still got this to sort out here. We'll go off on the video and show you some more in a minute. Okay, so let me get back to the probe. I want to show you what we've been looking at here, trying to decide if we can repair this or not. I'm going to get this, just feather that and get it to drain. So the meniscus is fine up here. You can see this edge, that looks great. Right when we get here is where this horizontal cleavage tear starts right there. Okay, and so that is going to be the issue. I'm going to give you a better picture of it here in just a second. Okay. Okay, so now what we can see here is this horizontal cleavage tear starts right here. Horizontal just means it runs this way. The capsule is still attached. There's really nothing in the undersurface that I can repair. And most importantly, I guess, is that the root, when we push way back here, that this part of the meniscus is okay way in the back here. So we probed this also, and this area back here is okay. So it's really just this horizontal cleavage tear, which in my experience is not something that will hold a stitch and probably ought not be repaired. We're going to get to work here and show you a little bit more. Okay, we've trimmed back the part that was torn. You've still got a good rim of meniscus here. And we've been able to take care of the part that I think was bothering you. We're going to continue to fine-tune it a little bit, but this is basically what it's going to end up looking like, so that's good. We'll look around the rest of the knee and show you some more in a little bit. Okay, so this is the central part of your knee. This is your anterior cruciate ligament right here. That looks great. There's your posterior cruciate ligament behind that, but this is your ACL. And I'm very happy with the way that looks, okay? Now we're going to look in the lateral compartment. We can open it up just like this sometimes, and the anterior horn looks great. Posterior horn back here, if we go up into what we call a figure 4 position, we can open it up a little bit more usually. And now we can see the posterior horn. That looks good. We're going to probe it, but on the face of it, this posterior horn looks great, as does the lateral compartment in general. So at the top of the screen, this is your patella. We'll take the shaver. You can see there's a little divot kind of in the central part of the patella up there, right here. I just want to make sure there's nothing loose. It doesn't seem like there's anything really loose. And that's just part of the patella, part of your kneecap. The medial facet over here looks pretty good, and then the trochlea here looks good as we come down the front. So really, the medial compartment has that meniscal tear, and the patella has this little chondral injury there that I don't think is unstable. And I really think that's it. So let me see if I can get you a slightly better look at this patella so we can document it for you. There it is right there. Again, nothing unstable. This is something that we hope our PRP, and if necessary, even our bone marrow concentrate injections can help with, in terms of minimizing any symptoms from something like that. And again, the trochlea here looks pretty good. So we're going to finish up here shortly, get you back to the recovery room in a little bit. Good luck to you now. Bye-bye.